Good morning, class. In today's lecture, we're moving from the lungs up to we'll look at upper respiratory issues. We'll look at things in the head and neck, pathologies up there. And we'll leave the eye to a separate lecture, and the brain will be in the central nervous system. But we'll deal with the mouth, the teeth, lymph nodes, larynx, pharynx, things like that. All right. So first we'll be in a review of the important structures so that we can talk about their pathophysiology. So the oral cavity is a space. Inferiorly, your tongue takes up most of your oral cavity. Superiorly, your hard palate. Then the soft palate behind it with cartilage and your uvula hanging down. And if you look beyond that, you see the back of your throat. Anything beyond this kind of arch, here will be your oropharynx. So your oral cavity is in front. It's bound laterally by your cheeks, the buccinator muscle. So your tongue and the buccinator muscle will work together to keep that food over your molars to chew it up. And how the teeth come together is called occlusion. You can have malocclusion where they don't come together quite right. Yeah, and then the lips will make a seal used for suckling when you're a baby. And very sensitive, lots of nerve endings for be able to taste your food on its way in, get some information about temperature and such. Yeah, so yeah, we're looking at the oral cavity here. Behind it's the pharynx. And then your larynx will be your voice box. And then your nasal cavity is above. And you can see we have this palate that's going to separate our oral cavity from our nasal cavity above. Yeah. And so you can see one other thing here is that our respiratory system, our digestive system, they cross. And this is a really dangerous area in humans where you can get the food and drink going down the wrong tube, right? And so everything's got to work well when you're swallowing. I mean, you need to have proper reflexes, proper brain function to do that. And you need to be paying attention and not telling a joke while you're trying to swallow something because potential for asphyxiation there if you get something caught. You got salivary glands. They make spits or saliva. Your big ones are your parotid glands here in front of your ear, the biggest ones. You have submandibular glands under your chin, and then sublingual gland, the smallest, to be right under your tongue. And they have varying mixtures of mucus and watery secretions. And including in it is amylase. So you start breaking down starch in your saliva. And yeah, you can see here the parotid gland has a duct that opens above your second molar. Your submandibular glands have ducts that open underneath your tongue. You guys know what that's called when you can spit like that? Gleeking as a name, when two little ducts open underneath your tongue. And the sublingual gland has many ducts that open under there. And saliva, first of all, it's going to wet your food and moisten it as you chew it. It becomes a bolus of food that you push to the back of your throat, and the swallowing reflex happens. And you make a lot of spit, Look at that. Over a liter, every day. If you chew tobacco, a whole lot more, right? And the purpose of saliva, besides wetting the food so you can taste it and getting it ready to lubricating it so you can swallow it, got a lot of bicarbonate ions in it. So it really helps with the pH in your mouth. We know this because people addicted to methamphetamines, things like that, really bad teeth. And I always wonder why, what's the correlation there? And one of the things is it cuts down on saliva production. And then there's other cases you don't make saliva, and then the acidity can really eat away at your teeth more rapidly. So just having spit, even when you're sleeping, helps you keep your teeth in good shape. Yeah, and then, saliva production, parasympathetic is rest and digest. That's going to stimulate saliva. And then sympathetic, if it's fight or flight, you're just going to make very little saliva at that point, more and more. Your mouth gets dry and sticky. The nasal cavities, you've got these delicate little turbinate bones or nasal conchae that are lined by that epithelium, that nasal or respiratory epithelium. So it's kept moist and warm. And as the air comes in through your nose, it's going to be filtered. Anything that's any dust, etc. Well, not all of it, but it's going to stick to the walls because it's forced to go through that complex little chambers there, and it'll help you clean out a lot of particulate matter. And like I say, warm the air before it gets to your lungs and moisten it. The part just inside your nose is the vestibule. That's just skin that comes in. If you look a little bit further, you'll see that pink respiratory epithelium, which is most of it here. And then there's, of course, most superiorly is your olfactory part of the nasal epithelium. And in your brain, your olfactory bulb sits there, and that's where your sense of smell happens. Your sinuses. You have these hollow places in your head. The biggest ones are your maxillary sinuses here below your eyes. And then you have frontal sinuses here, then a group of sphenoid and ethmoid sinuses. And a sinus is a space, and these are your paranasal sinuses. They're alongside your nasal cavities, and they occur in these four bones. And they lighten the head, they resonate your voice. Otherwise, if it was solid, your head would be heavier. And they're lined with that epithelium, the same nasal epithelium, and they have connections to your nasal cavity. And the frontal one, gravity will help drain it, and the others, but the maxillary, your biggest ones, they're the hardest to drain because when you're standing or sitting up, gravity, you're working against gravity because the ducts go kind of upward. So you'll see people often have restless nights if they're congested, where they'll turn from one side to the other of their head. They're draining the two sinuses because they don't drain as easily. So they're connected to your nasal cavity, these sinuses. So if you have a nasal infection, it's going to travel to the sinuses, and the sinuses can become clogged and filled with fluid. So you're all familiar with that. And this is the beautiful epithelium that goes up your bronchi and your trachea and in your nasal cavity, this pseudostratified columnar with beautiful cilia and then scattered goblet cells that make the mucus. And so in your trachea, it's that mucociliary escalator that moves stuff up. And here it's moving stuff. It's going to trap particles in the mucus, and you can get rid of them. All right, this is the pharynx. Don't say pharynx. Okay, pharynx, pharynx, like ink, is going to be this back of your throat region. All of this. Yeah, so in front, here's the oral cavity, nasal cavity, and back there's your pharynx. And again, it's a complicated place. You got muscles for swallowing there, and you've got a mixture. You've got air coming all the time. You can see you can breathe through your mouth or nose or both. And then when you swallow, you need to shut off the airway. This epiglottis will cover over your glottis, the opening to your larynx and trachea, and the food's going to slide over it and go, and the esophagus will open behind it. So swallowing it, very complex, and things can go wrong back there. And you can even delineate the pharynx too as having a nasopharynx, oropharynx, and laryngopharynx. So they're areas. There's no door between them. They're continuous, but we can name these areas. Yeah. Look at here. I can see this is the opening to the auditory tube where the ears are going to come in. Then there'll be an opening where your tears will come in from the eyes. So there's fluid dumping in there. Yeah, and then looking at the back of the pharynx here, you'll also see this ring of lymphatic tissue, your tonsils. And the obvious ones back here, your palatine tonsils. They're really obvious when they're inflamed like this. And so if you get constant tonsil inflammation, they may decide to just rip those out. You can live without them, but they have lymphatic tissues. So they don't like to just rip them out, or your appendix if they can help it. And then you have a nasopharyngeal tonsils that are, you can't see them. They'll be up here, commonly called your adenoids too. So those can cause issues too, and those can be removed. And then the back of your tongue has this lingual tonsil. The root of your tongue has tonsillar material. So you can see there's this ring of tonsillar material because it's an entryway for pathogens. And so you have all these things to monitor it there. And also your eustachian, we call them auditory tubes these days, but they come in from your ears to help equalize that pressure. Your larynx, your Adam's apple, your voice box. So this is made out of hyaline cartilage. And it's really influenced by testosterone. So when your voice changes and cracks as you go through puberty, peaks of hormones, men usually have bigger larynxes, therefore deeper voices on average. Tall, slender men, there can be a keel on it there as well, some people. So that's your larynx. Within it resides your vocal cords. Then your epiglottis, this is a weird view, but if you look way back in your mouth, it looks kind of like a shovel from this view. And here's your uvula hanging down. Your epiglottis is made of elastic cartilage inside of it. And it's when you swallow, your Adam's apple goes up, your epiglottis covers over your larynx, and then it has to flip back. You get choked on a chicken wing or something, it's gonna prevent it from flipping back, but it needs to flip back so it's constantly open unless you're swallowing. And then look at all over here, we talk about an upper respiratory tract infection, and it can spread to a lower respiratory tract infection when it gets into the lungs and you get pneumonia and such. So yeah, above we have the nose, nasal cavity, your sinuses, your pharynx and your larynx. And then we call lower everything from your trachea down to your bronchi, the lungs, bronchioles. So we can easily separate it like this. And then the ear. We'll talk about the eye in a separate lecture, but the ear we'll cover today. And the ear anatomy, y'all remember you have an external ear, a middle ear, and then your inner ear. And your inner ear, we don't do a lot of surgery with. It's within your temporal bone of your skull. It's just hard to get to. And then cranial nerve, remember which number for hearing imbalance? Number 8, vestibulocochlear. It's going to carry away sensory from your sense of balance and hearing. And then your outer ears is the auricle or the pinna. You can have wrestlers get cauliflower ears. There's some issues there. We don't have time to talk about everything. And then this auditory canal comes in. It's lined with glands that make wax. They're called ceruminous glands. And you can have wax buildup. You can have foreign objects in there. And at the end of that little auditory canal is the tympanum or eardrum. And the tympanum's, I'll show you a picture, thin membrane, and it's water and airproof. So your outer part of your ear and your middle ear are separated by this. So things can't move between them unless it's burst. Your middle ear, it's filled with air. It has the 3 ossicles or bones, right? Malleus, incus, stapes. And the middle ear is not an island. It's connected by this eustachian or auditory tube into your nasopharynx. And you go in an airplane, your ears pop. You may go like this if you scuba dive. You want to clear your ears. The pressure in there will change. You need to equalize that. And then, of course, in your inner ear, your cochlea holds your organ for hearing, right? And your vestibule, these semicircular canals, are for balance, static and dynamic balance. So your neck, God, a lot of important stuff going on, right? You go for the jugular. We know the neck is an area that, of your extremities, you can use an arm, you can lose an arm and a leg, you can't lose a head, right? It's got your brain and a lot of important things there. And your senses are all gathered. Your special senses are gathered here. Your hearing, your taste, your smell, right? Vision. And the neck itself has muscles. You have your cervical vertebrae in the back. So you remember your atlas and axis along this kind of movement, all these muscles, sternocleidomastoid, and a whole bunch of muscles in there. And then your external jugular vein will run superficially in the skin, but deep in there, and you feel your pulse, you're feeling your carotid artery. So that's the big artery that's going to serve your brain and your face and your head. And then the jugular vein, the internal jugular vein, runs with it. The vagus nerve is in there too. So you got important structures that run in there. I feel my larynx in front, my trachea down below, right? Above, I feel my hyoid bone, a thin U-shaped bone. And a lot going on there. Back, I feel muscles, a lot of nerves and muscles, and a lot of lymph nodes too, run in the neck for immune. And then my thyroid gland sits just below my larynx. So the thyroid gland sits there, and you can palpate that and feel if there's enlarged or not. Yeah. All right. Quick little review, just some things, bam, bam, bam. Y'all should know those things. All right, let's get to some issues. We'll just go over the big issues first, and then we'll get to each one of those. So dental problems, of course. The most common are caries, which are cavities, fancy word for cavities. And these are caused by bacteria that metabolize sugar, and the acids will eat away at your enamel and dentin. And then periodontal disease, another big issue is this means around the tooth, like perimeter of the tooth. Dont means tooth. And if you have inflammation because you have bacteria that grow in there, this plaque, this calculus, the gums recede and they're inflamed. And the more they recede, the more the tooth is exposed and you can lose your teeth. So periodontal disease, you look at this person here, then you really need to brush and floss and get that scraped off to have healthy gums to keep those teeth. Upper respiratory infections, URIs, of course, very common, colds, influenza, COVID, things like that. And sinusitis is going to be sinus infection. So because it felt the pressure, right? If your sinuses are inflamed, rhinitis is, rhino, like a rhino with its horn, its nose. So it means you're going to be a nasal drip and a lot of fluid there. That can travel, to your sinuses. It's any kind of respiratory infection can go between your sinuses and nasal cavity. And if it gets really bad, of course, it can lead down to pneumonia if it's allowed to travel deeper in your lungs. And then the flu, influenza, caused by a bunch of viruses that change a lot. So, our flu vaccines are like, need to keep watching a moving target. And taking a look at CT scans of the head, you notice that here's my nasal cavity. You see there's a septum. The nasal septum is a wall that separates the right and left nasal cavities, so they're separate. And then you can see the turbinate bones or the conchae that come out. And then these are where your eyes are, your orbits. And then this is your big maxillary sinus. Huge, right in here. When you do a dissection, you can break away this bone and stick your finger in there. So there's a lot of space right there underneath your eye. Another thing is you notice the proximity to your upper teeth as well. So you have a sinus infection causing toothache, or toothache causing a sinus infection because they're so close. And then you can see some issues here. Beautiful. Look at this. It's a little more resolution. You can see in this maxillary sinus, you got a bunch of snot in there, a bunch of mucus. And then can this person breathe out of his right or left nostril? You can see that. Probably the left side there, how swollen the epithelium is around the conchae. So that person is stuffy in one of their nostrils. Antihistamine will bring that down. Otitis media is a middle ear infection. You see that with kids a lot. And the reason why is you're supposed to hold a kid a certain way when you feed. I don't have a kid, so you give it the milk. You're not supposed to. So you don't want that milk, to go up in the eustachian tubes and get in that middle ear. And so in infants, it's more direct and it's shorter distance. So infections that you have in the nasal cavity can reach that middle ear easier than adults. Adults can get it too, but I'm just saying it's kind of a kid thing. We'll talk about deafness. Many causes of deafness. Here's a view looking through an otoscope, looking at your eardrum, your tympanum. And this is healthy. You see it's a thin membrane, has skin that goes right over it. You take your temperature off that. And then you're seeing the bone in there. The malleus has a little part that comes out, and there's a muscle that keeps a tension on it. And it's like a speaker. It's going to move when air pressure goes. It's going to move. It's going to be amplified by the bones. It's going to go in that oval window to make the fluid in that cochlea move. And this is bad. Look right there. Ugh. Yeah. So, and pus can build up behind it and burst it. You can put tubes in it, right? Allergies. We'll talk about allergies. We talked about asthma in the lungs. Allergies. It's going to be an inflammation. Be a hypersensitivity reaction to some kind of allergen, we call it. Yeah. And you're going to see stuffiness, and then even conjunctivitis on the conjunctiva or the membrane on your eye. And then neoplasms, cancer. The cancer we're going to find here, head and neck, usually is going to be a squamous cell, forms from the tongue or on the larynx or the mouth, almost always related to smoking. And here's some cancer in the larynx. All right, Let's look at some symptoms and signs and tests that if we're looking at this area right here. Well, first of all, dentist-wise, you go get your teeth looked at, regular dental checkups, so important. They'll also check for neoplasms. They'll look for like your tongue and see if they can catch a tumor early on, but mainly looking at the teeth. They'll look at the teeth and the jaw, and the cleanings help stave off periodontal disease. They'll be able to probe for caries to see if there's a soft spot. And even ones they can't see, they'll take x-rays and be able to see those. So again, good dental hygiene and good dental appointments will help keep your teeth as long as possible. Your ear, use an otoscope. Here's one you can buy online. You can connect it up to your iPhone. Take a look in there, and you can look in there and see what's going on. See if there's any blockage. See if you can see if there's fluid behind there or pus. Yeah. And then palpation. You'll always be looking, to see if your glands are enlarged. We're looking at the lymph nodes. It'll be evidence of infection. Nasal passages, they can put a camera up there. They have just same thing as the otoscope. They look in the ear. They can look in your nasal cavities if they suspect there's an issue up there. Even more specialized, they can use mirrors to look back there, or a scope, a laryngeoscope. They can put through your nose down to take a look and see what your vocal cords are doing. You guys want to look at the PowerPoint. There's a good link here showing how the vocal cords work when they're singing, when you're talking. Yeah. And of course, the radiographic techniques, beautiful. This is actually my head. I got an implant here, so I got that tooth back. But it's a panoramic view. They can look bite wings, and so they can get a real good look at your teeth and jaw and see what's going on. And now they even have this 3-dimensional scanning machine that it's a movie. It's just, the technology is just amazing. Yeah, and they can use CT scans also to look for, tumors in the head region, and MRIs as well. Yeah. And this is fluoroscopy, where they put a radio-opaque dye and they can look at swallowing. They'll take maybe an anterior view and see if something's deviated or constriction. So that's pretty cool. For hearing, audiometer, where they'll give sounds at different frequencies and they'll ask you, do you hear this? And so it's a way to test hearing. And of course, microbiology, right? You go and you got a sore throat, they're gonna do a swab, see if you have strep, see what's going on. So, and this is the old fashioned way, growing out of plates. Now they have DNA techniques where they can just tell you what you got. All right. There you go. So you guys know, ear, nose, and throat, you go in there. It's obviously, mostly we're talking about colds and allergies as a main issue, and teeth issue and sinuses, but we'll talk about some other things too. So we'll talk about two things that are genetic or developmental. And we'll talk about deafness, and we'll get to this some more. But if you look at deafness, you can see about half are genetic. And so these are often part of syndromes. So if you have chromosomal issues or genetic issues with syndromes, deafness is one of them. So you look at many syndromes, you say, oh, deafness is one cause. And yeah. And you're going to see idiopathic means we just don't know. And then non-genetic, developmental, or it could be some insults during fetal period. Yeah, and so of genetic, most are connected to some kind of syndrome. But yeah, when you see deaf children born to hearing parents, yeah, and so you say, of course, that can occur. Something is going on. And the other thing is a cleft lip, cleft palate. You can have both. And when you look at development, late in development, one of the last things that happens here is that you have the two sides close together. Even your frontal bone, sometimes people have a suture, they come together, your palates and your lips come together and they fuse. Well, if that doesn't happen for some reason, you're born with it still open. And you can see how beautiful surgery works with a cleft lip and a cleft palate to fix that up. In some countries that don't have healthcare, Doctors Without Borders, people can come in and offer this really life-changing kind of surgery. But if you have health insurance, it should be able to be fixed. But that cleft palate, yeah, it leaves the nasal cavity open to the oral cavity. So it's going to be difficulty breathing and swallowing. And so you definitely want to fix that. All right. So now let's get to the rest of the diseases. And we'll start with dental caries or cavities. And people have different susceptibilities to this. I have good, strong teeth. I don't have many cavities. But what's going on is that in your mouth, you have a whole fauna of bacteria that grow. There's even a nighttime and a daytime crew. During the day, you have lots of oxygen and you have a lot of aerobic bacteria. And at night, you have more anaerobic bacteria. You think about they grow so rapidly that they kind of change. And so the ones at night often give you real bad breath. You wake up with that horrible breath, a lot of sulfur containing waste coming out. And so, yeah, so you have this microbiota in your mouth. You also know this, we talked about endocarditis, how dental procedures, that bacteria can get in the blood and make their way and grow on your heart valves too. So a lot of bacteria grows in your mouth, nothing you can do about it. Of course, brushing and mouthwash, you can do things to keep it down, but it's just a natural part. It's like your gut has natural bacteria, your skin is bacteria that grow with you, don't usually cause a problem. But the issue with teeth with these bacteria is they'll form a plaque. This really shows it nicely. And calculus, when it gets like hard, solid, it needs to be scraped off. And what this does is it causes an inflammatory response in the gingiva or the gums, and the gums recede back from it. And if they keep receding, you're going to have bone loss beneath it. And eventually, the more and more bone loss, the root of the tooth gets looser and looser, and it's going to fall out. And you can have bone grafts that go in and replace that bone, or gums can be brought up again. But you want to avoid this by teeth cleaning and flossing and really getting around the tooth. You can even massage the gums to make them stronger and tougher too. And the issue with the bacteria aren't actually doing any drilling in your teeth, but they metabolize sugar, and then their waste is acidic, and that slowly eats away at enamel and dentin. Fluoride came about, and if you Google fluoride, actually you'll find a bunch of people that think it's the government putting fluoride in our water to calcify our pineal gland to control us, and there's a lot of crazy stuff out there. But fluoride, it binds with calcium to the teeth, and it's more resistant to decay. So we've had fluorination in our water and in our toothpaste and fluoride treatments because we know it helps prevent caries. So enamel is the hardest part of your body, harder than bones. So when we find at archaeological digs or in paleontology, we find teeth because they're the hardest part. The rest of the body, the bones will decompose, but the teeth will last the longest. And caries it's really a pandemic. Right? An epidemic is when a disease kind of runs rampant. Pandemic means around the world, like COVID's pandemic, HIV's pandemic. And dental caries came about. I mean, they've always been around, but especially when we started to make processed sugar. So with sugar cane and then sugar beet, people eat more processed sugar. The more that stays on your teeth, it's really good food for these bacteria. And it'll start with just a softening, a discoloration in the enamel. And that's why regular dental checkups are important, because they'll catch it early. It's so easy to just fill that in, right? But if it's allowed to continue, it's going to get to the point where it's going to hit the dentin, and there's some nerves in the pulp that get a little bit into the dentin. Then you're going to start to feel the pain finally, maybe sensitivity to heat or cold. And then if it's just allowed rampant, this infection will reach the pulp, and you'll get pulpitis, where the pulp will be infected, and then the serious pain comes, and then the tooth. You could do a root canal where you just clean it all out and fill it in with cement. It means the tooth is dead, really, because it doesn't have the nerves and the pulp and the blood vessels. Again, if you excise the tooth, you can put in a post and put a new crown on it too. Yeah, it's best to keep your real teeth. They're alive, they move. Yeah, so pulpitis is when you have infection, it gets into the dental pulp, and that a lot of pain because the nerves are there. It's just that's horrible. And you can have abscesses, and the bone can get infected there. And so let's stop caries early. And looking at the world here, there's not hardly any adults that get away with not having a cavity, right? And kids, you can see 60 to 90%. And it varies really depending on the kids, the diets and their dental care. And just to show you too, that kids in poverty are 1.8 times more cavities. And so it's about dental care. It's about well, good diet and mostly dental care is being able to take them there. So looking at the world, you can see the green and the, I'm sorry, the red and the yellow mean a lot of issues. So look at the difference between Western and Eastern Europe, you know, and the British, not known for their teeth. I'm British. I mean, yeah, British, German, French, kind of my thing. Yeah, but looking at low and very low, good places, you know, the US and Canada, we have pretty good dental care. Now it's periodontal disease, perimeter of your tooth, periodontal. And I show you kind of an earlier and a later stage of periodontal disease. And so the gums bleed easily, they're red and they look infected. And you might not notice it. Most people don't notice it unless you kind of look at your teeth a lot. But the dentist will, definitely, experts that look at it and say, oh, yeah. And again, you want to try to stop it, slow it down. There's a saying, when you get old, you get long in the tooth. People say you're long in the tooth. And your teeth don't actually grow longer when you get older. Just as you get into old age, your gums recede and your teeth look longer. That's where that saying comes from. Yeah, and so your teeth, God, think about, you know, 80 years of drinking, you know, Diet Coke and all that you do to have your teeth that long. That enamel, when you make it, you don't remake enamel. So it's just, it's all you got is what you get with the adult teeth. Halitosis, bad breath. And you know, clearly you eat a bunch of garlic and you know, you're gonna have bad breath, but this is caused by the bacteria in your mouth. And mostly that real bad breath is the amino acids given off are the sulfur containing ones, so it makes particularly nasty breath. And then we call this, well, trench mouth, but acute necrotizing ulcerative gingivitis. You know, this thing is a really bad breath, and they may even give you antibiotics and such. So it's just a severe form of halitosis where you have special bacteria that really go all out to give you that bad breath. All right, herpes, there's many kinds of herpes viruses. Herpes simplex type 1 is going to be the one that causes the cold sores, or the sores around the lips and mouth usually. And normally you get this virus, it's very common, get it as a kid, and then it'll pop up when you're stressed or, you know, compromised, or you get sunburn, it'll come out again. So you can get these cold sores for maybe it seems like no apparent reason, and then they go away and come back because it resides in those nerves and just wakes up now and then. So yeah, usually in childhood, you get the virus, and it can, when you have it, the primary infection, there can be other cold-like issues, and then it reactivates, and these cold sores can come back. You can see some here on the palate, on the lip, on the outside of the lip. Now, canker sores are not caused by a virus. It's the causes are we're not really sure, but there's many things that can contribute to it. But these are sores in your mouth. They often have a kind of oval around edge, and they come and they go in a week or 10 days. Very painful, so you can, you know, do some things to alleviate the pain, but otherwise just they'll go away. Yeah, and I showed some pictures of them. So maybe you guys have had canker sores. All right, URI, upper respiratory infection. Now, you guys are very familiar because I don't think anyone has not had an upper respiratory infection, but the sore throat. And see these terms here, like you'll see rhinosinusitis, rhino is nose, sinuses you understand, laryngitis, your larynx, tracheitis, right? Tonsillitis, pharyngitis, otitis media, be the middle ear. So these terms, just anything with the itis, you know, it's an infection of those. And so here, rhinitis, nasal, blowing nose, everything like that. And of course, headache, fever, fatigue, sometimes muscle ache, and these things right here. But this is the clinical presentation of an upper respiratory infection. And you know, you get that checked out. You want to know, is it viral or bacterial? Usually viral. And is it strep or not, right? I think I'm giving away an answer. Usually these colds are self-limiting, means there's nothing you can do except just rest and take care of yourself and hydrate and help with the symptoms, right? Antihistamines or Tylenol, but you can't cure it. It's going to go away. So your body's going to fight it off and then you'll get better again. And we can't really get a good vaccine for this because it's just changing so rapidly. The virus in mumps is stable. We know how to get it, but this one is all different varieties. And so we just kind of live with this. And it's a huge drain. Colds make up a lot of the missed days of school and work. So if you could figure out how to cure the common cold, you'd be in good shape. But obviously it's very contagious. And these days we're familiar with coughing and sneezing and how to do it properly, right? Like a vampire. So very contagious. And so it's just spread in this human population. And these viruses are organisms just like us, and they want to survive. And the best way they can survive, you're going to fight it off and kill them. They got to find other hosts. So by making you sneeze and allowing you to get out helps you pass it around. And I'll take this time, I don't know if I really got to it, but when you look at diseases, there's very few that kill you right away because that kills the host, it kills the disease. So like Ebola, you get violently ill and you're going to die. It's very fatal. What you want is a disease like a cold or something where you're actually healthy enough to spread it to other members. And it's not thinking to itself, the cold's like, oh, I'm going to get you to spread it. It just, those that spread it, those that make you sneeze are more likely to leave more copies of themselves. And evolution, that's all it's about. And so diseases, what we find are ones that are successful, make you sick but don't kill you and allow you to spread it very much. Cholera, so you're always got diarrhea and the bacteria is always going out and you survive that. So deadly, fast-acting diseases are very rare because in evolutionary terms, they're not very successful because they're not going to find new hosts. Because once you get over the cold, you've killed it. It's not going to be able to spread anymore. So it wants you sick. It wants you out enough to spread it to other people. There's a sidebar for you. No cure to the cold, of course, but there's lots of cold medications to help with the stuffiness. And you'll hear things about zinc, vitamin C. These things have not been proven to do much definitively, but a lot of people will swear by these remedies. But if there was an absolute link, we would be prescribing these things. We would be doing it. So there's ideas what we can do to help your body pretty much help it with its defense. So these upper respiratory infections, mostly viruses, but sometimes bacteria can cause it. And these viruses, there's nothing you can do about it. We don't have any antibiotics, are useless. But if it is a bacteria, we can give you antibiotics. So that's why you'd like to know. And there's no easy way. You can't look and tell if it's strep versus a virus. Same redness. So some people say, "Oh, I can tell," but they look very similar. You need a test to really to tell the difference. But yeah, rhinoviruses cause most colds, and then coronaviruses. And so there's lots of those that cause cold. The COVID-19 is a particularly nasty one that has transfer probably from bats, and it causes, can just cause some people mild or asymptomatic or just upper respiratory, but it can travel to lower respiratory and really do damage on the lungs in some people. And we're just finding out new things about how it damages blood vessels. And so it's just, we only know it for a few months at the time of my recording here. It's cousins of coronaviruses. There's lots of coronaviruses. They say coronavirus, it's not all scary. Some of them cause the common cold. So immunizations, beautiful against the flu. They're not 100% because we just do our best guess on what strain is going to be around this year. Normally it doesn't matter. Do we need to know which coronavirus? It's a cold. It's going to be gone in a week. So no one puts in their chart which cold virus they had. I mean, if you have a cold, it's gone. There's nothing, there's no difference in how you're going to treat it. You just got to let your body fight it off. But if you have a cold, there's one thing we do worry about. And that is, of course, strep, right? So if it's strep, we want to treat that because you guys know from an earlier lecture that streptococcal bacteria can travel in the blood and cause other problems, most famously cause rheumatic fever in your heart valves. It can grow in your heart. So with a strep, if they can think it could be strep, you want to do, they have a rapid test, but you guys know you got to kind of wait for those results to come back. So they'll take a swab and definitive. So even if they do the rapid strep test and then give you antibiotics, and then they want to do the longer test to confirm that. But your antibiotics, you don't want to give it for a common cold because you're just encouraging antibiotic resistant forms and it's useless for you, right? So you just want to make sure you only use antibiotics if it's bacteria. But a lot of providers, sometimes they're just pressured to do something, and let's give them, the mom's complaining or dad's complaining, and give them pills and you should not do that. I mean, if it's a cold, don't get antibiotics, let it run its course unless you know it's a bacteria. Yeah, as you can see, strep, and you guys as potential future healthcare professionals, can look more at what's the difference between cold and strep. So normally, I guess it's limiting, it's not a big problem, but sometimes upper respiratory infections, are going to spread to the middle ear, right? Sometimes you'll have enlarged tonsils that are going to obstruct breathing, either your adenoids or your palatine tonsils. And if it's continuous, maybe they want to remove those. Croup kids will have this cough. It's like it's a very sad kind of sounding cough. And if you have inflammation here, it's going to cause this kind of, the air is like moving through a wind instrument. It kind of makes this noise. So yeah, if you have a baby that has this horrible cough. And then a upper respiratory infection can spread to a lower respiratory and cause pneumonia. All right, sinusitis, sinus pain. So these mucus-lined cavities are continuous, either nasal cavities. So infections will spread and your sinuses will fill up with fluid and pus and cause pressure and pain. And some people have real problems with sinus issues. And you can see this person with these thickened sinuses. And then when the epithelium expands, it closes off those tiny openings that connect it to the nasal cavity. So pressure will build up because the little tiny openings are the only connection. And so the fluid has to leak out through that. And if it's closed, sometimes polyps grow and obstruct those little holes. And so you have this pressure. Yeah. And they could talk about chronic sinusitis, if you have a chronic problem this is going on and on and on. But if it's lasts less than a month and you don't keep having them, there's called acute sinusitis. Yeah, take a look. You can see normally it's clear, air flows through that passageway, fluids can escape. But when it becomes inflamed and it can fill up with fluid, and then you can feel that pressure. So sinusitis, congestion, headaches, pain. Sometimes you can, if you tap on the head here, you feel pain if your frontal sinuses are filled, or down here, you can feel pain. Sometimes not, you feel pressure. Yeah, and then as I mentioned, your maxillary sinus is just a thin bone away from your upper teeth in your maxilla. And so you can have tooth pain causing sinus pain. Sinus pain can cause your upper teeth to ache. So diagnosis, I mean, they tap, they feel, you feel the pressure, is what it pretty much does. You can do a radiograph if you're serious and you want to see, and you can see the accumulation of this person's right maxillary sinus. And yeah, it can be caused bacterial or fungal too, more rarely, but they can give you antibiotics or antifungals to help clear up the infection. Of course, there's anti-congestions, antihistamines. And if you have chronic sinusitis, they can use steroids even. That'll help lower that immune response, or surgeries. You can see here I found these different balloons that can go up and widen those spaces. Or if there's polyps, they can go in and remove them too. Or you can even like remove all the lining in there. It's just hollow. I always thought you could, what if you filled them in? But then with something that's going to be heavier, but they're just kind of a pain now because they're connected to the nasal cavity, and they're just spaces, and they have this. If you have constant infection in them, you don't need them. They're just spaces. All right, hay fever is interesting because it doesn't usually involve hay and there's no fever. So allergic rhinitis is better. It's an allergic reaction. Allergies, like here we talked about asthma too, it's kind of related, and eczema and food allergies. They're all these atopic. I talked about that, how there's foreign substances that cause you to have a hypersensitivity reaction, and your body kind of overreacts, right? So this will be similar to the cold and having, runny nose and itchy eyes and things like that. So it's having similar symptoms. And again, you'll see this eczema or this type of dermatitis and asthma, things are all related. Talk a little more about that. So the triggers, similar we talked about with asthma, usually it's ragweed pollen, or it could be a dander or cockroaches, things like that. Dust mites will cause this allergic rhinitis. And yeah, if you take a look here, look at, see this relation here. Food allergies usually come out early in a baby's life, and then eczema, on the skin kind of rashes come about. And then you see asthma and this allergic rhinitis. So a lot of study here to see the causes here and what we can do about this. And is that hygiene hypothesis involved? So allergic rhinitis or hay fever, not fatal, not gonna kill you, but it's just a pain in the butt, isn't it? So you do eye drops and antihistamines and such. And there's even some controversy here about giving you the allergen so your body is more used to it. So when you actually encounter it, you don't overreact. So the whole thing, you can look at that if you're interested. All right. Infection of your middle ear, otitis media. You'll see in kids, even before they can talk, if they have this, they'll be crying and kind of like clawing at one ear or the other. It gives you a little bit of a hint that maybe that's what's going on. And then you take a look with an otoscope, and if you look in there, you can often see pus, or the tympanum is bulging out because of all that pressure behind it. And if you have an upper respiratory tract infection, that can spread right up those eustachian or auditory tubes to that middle ear. They're connected. And again, in children, it's more direct and shorter. And so you can imagine you get some milk up there, beautiful, warm location for bacteria to grow, right? And if it's purulent, you have this pus that will build up and cause you can't hear, and then it can even burst the eardrum. So diagnosis, usually just take a look at the ear. They can give you some antibiotics for that. If it's a real problem, they can put tubes in your ears. It's a very common surgery, little size of a pencil lead, and will allow drainage so that there's not a blockage there. They can put a syringe and suck out some fluid too. So yeah, you don't see it as much in adults, but you see it a lot in children. And it can even cause, look at delayed speech, language, social things. If you're not hearing right, it's an issue. So if you have a child that gets a lot of middle ear infections, you have to think seriously about how that affects them. And when you see purulent or pus-forming bacteria, that's when you can have drainage out of the ear like that. And it can even spread, this middle ear infection, it can spread to the bone, the mastoid bone here, and the brain. And so I don't want to scare you. My kid has an ear infection. Oh my God, it's going to spread to the brain. But there are serious complications that can happen if those bacteria get into the bone. And you're right in the temporal bone, close to the brain too. All right, hearing loss. All kinds of ways to be deaf. You can see over 100 types of inherited deafnesses. A lot of these come with syndromes. Some of them are just other genetic causes. Yeah, there's sometimes chemicals, antibiotics and stuff are implicated, and they're called, they're ototoxic. They cause problems with the ear. So iatrogenic, remember, this is caused by our care, by doctors, physicians' care. Yeah, definitely head injuries, degenerative infections, deafness, infections even in the womb. And you can see deafness increases with age as you get older. The insult on the ears adds up. So in the world of deafness, there's really two categories. Sensorineural has to do with the nerves in the brain, looking at that part of it. And conductive has to do with the ear canal, the tympanum, and the bones. And so getting in there. You can imagine that conductive might be easier to fix, burst eardrum, or God, those ears, the ear bones are so tiny, but they can work on those if you have an overgrowth of bone. And you can see also it's usually a mixture. You can see this kind of Venn diagram where you can see causes of sensorineural, causes of conductive hearing loss, and things that are in between. So yeah, congenital hearing loss. And in a baby, I mean, you don't notice at first if they're deaf. I mean, they're not talking or anything. They don't understand any words, but you'll notice when they don't react to sounds, and then you can take a look at it. And there are some infections, it's like toxoplasmosis. The bones can just developmentally form wrong. Genetic conditions. Remember, it can be some drugs or taking during when mom's pregnant, or premature infants too, which can be deafness. All right, when you get old, your hearing gets worse, especially in the high frequencies. They even make signals on the phones that young people can hear, but the teacher can't hear, you know that, or a dog whistle, they can hear higher frequencies too. But presbyopia is when your eyes get bad when you get older. Presbycusis is when your ears hearing gets worse as you get older. And particularly as you take a look at the high frequencies. So you can't hear that. So conversations become more difficult. And with old people too, this is a big social thing. You're gonna see they often don't get it fixed. It's one of these health conditions that is there's too much of it, and people don't like hearing aids. But older people, they feel socially isolated if they can't hear a conversation, if they're faking it. I can't hear things, sometimes they just smile and nod, So something that should be looked at not only from an older person's ability to hear for emergency purposes, but just for their social interaction and their mental well-being. And so if you see this, usually it's both ears. If it's one ear, something's probably going on, but it's usually both ears. Tinnitus is ringing in the ears. So the annoying kind of buzzing or ringing in the ears. That's what that is. And hearing aids, they're going to amplify the sound. And many patients, they don't like them. They say it doesn't really help them that much. The batteries are expensive. So, there's barriers to getting people to use hearing aids. And then a cochlear implant is completely different than a hearing aid. This is people with severe hearing loss and children. And there's even interesting controversy in the deaf community, whether some people are really against this, that, what's wrong with sign language and reading lips, and why do they need to change this if they're, so I find it fascinating, instead of just saying, well, of course you should get it. You can hear like everyone else, But this idea is where they put a machine outside that picks up sound waves, and then it's going to convert these sound waves to radio waves. And then you put surgery on the inside, there's a receiver, and it sends the signal to the receiver, and that's connected to wires that go right down into onto your nerve in there. And so it converts the sound to electricity, it transmits it, and then the electricity is put on there. So it's a different kind of hearing. You're not hearing the actual sounds through your eardrum. It's being converted, and your body, your mind is going to learn to interpret what these little impulses from that nerve, from that wire that's going on the nerve. Yeah. And sometimes with vision too, you can have a person completely blind, but have a camera that's going to record what's going on in the world in front of you. It's going to electrically go to a wire that goes on the tongue. There's like a grid on your tongue, and it lights up. It's supposed to feel kind of like bubbles. So in this case, you don't really see, but this feeling you're able to interpret if there's an object near you, and so it's like another way of using vision. It's fascinating. This is another way with hearing, using sound waves, and just your brain is going to, it's better than not hearing anything. It's getting signals when there's loud noises, and you can determine distances from objects because things echo back. So yeah, cochlear implants, yeah, completely different than a hearing aid and pretty cool. So otosclerosis, as it sounds like, this is ear hard, sclerizing is hard, like scleroderma. So what you have here is usually here you have bony growth, or if there's a fusion, bony growth, and it prevents these delicate bones from moving nicely. So they can go in and do surgery. They can shave off the bone to make this work better. But otosclerosis is something more common in women when they're young. And then cholesteatoma is a little bit of a skin growth behind the ear. It can grow and it can impede your eardrum from going. Neoplasms, cancers in there. Ototoxic chemicals can cause deafness. You're exposed to those, benzenes and things like that. And then you can look up psychogenic causes. This is interesting, where deafness comes from an emotional or traumatic kind of experience. So now remember, the nerve goes to the hearing center, and so your brain is part of it too. So I was reading about that last night. Pretty interesting. Just real quick, your book doesn't even mention it, but I'm throwing in motion sickness because I have a boat. I've been there on choppy seas, and then you get this feeling when your vision and your equilibrium information reaching your brain differs. So you're riding in a car and you're absolutely still, but you're seeing the world around you fly by, and that disconnect causes you nausea and uncomfortableness. So Dramamine, and they have various other things to help against motion sickness. All right, we'll talk about your salivary glands. One famous disease is mumps. And we don't hear about it much because we have a vaccine, MMR, that you get as kids, and then we don't get mumps. It works great. But of course, some people are like, oh, vaccines give you autism. They don't. But so it's made a little bit of a comeback for some people. But mumps is a viral disease, and your parotid glands gets really big, like that, like a chipmunk. But vaccines work great. And you can have stones that form within your salivary, the ducts. So sometimes you feel where the parotid gland, that little duct comes out, there can be like a little bump right there. Sometimes you feel that, or sometimes there's an obstruction that causes pain. Sjogren's syndrome is an interesting, cool disease that causes you to not make tears or saliva. You can't cry. Yeah, isn't that strange? It's a real problem because you need tears, and people that have this are going to have corneal problems, and because those tears are washing over your eye, and they're getting rid of the dust and stuff. And if you don't make saliva, your teeth are really bad. So this is a syndrome that happens. It's where it's an autoimmune, where it's one of the most common autoimmune diseases, where you attack your own lacrimal glands and make tears in your salivary glands. So they'll replace it with eye drops and such to try to help the symptoms. All right, lastly, we talk about neoplasms, cancer. And so we're talking about squamous cell carcinoma being most common up here. And you can see, oh God, on the tongue here, here's in your larynx, and strongly associated with tobacco, or it's a lot of alcohol, because it's going past this, just like it goes in your lungs, it goes here all the time when you're smoking. And then carcinomas, also, of course, these cancers can be a real problem because if it's on your larynx, sometimes they have to remove big chunks, and you can't speak. You get some kind of other kind of device you can get in there, and so you lose a piece of your tongue. So in these cases, you can't just simply cut it out and not have loss of function. Usually, if you have something in this area, it's going to be obvious physically and cause some kind of disability. And prognosis, of course, is related, as always, to how far is it spread? Is it to the lymph nodes? Is it how malignant is it? You can see in your tongue, sometimes you'll see this little bit of a leukoplakia. This little bit will be a starting point telling you about squamous cell carcinoma here in the tongue. Yeah. Hoarseness, difficulty swallowing, these things they want to look. Is there a squamous cell carcinoma going on? And so they can feel, they can palpate, you know, the lymph nodes will be enlarged if you've got cancer there. Here is an MRI showing laryngeal cancer. And so these lymph nodes, a lot along your sternocleidomastoid, along your carotid artery, along your jawline, you have all these lymph nodes that health professionals get to know well, to feel if they're swollen, it's evidence that something's going on distal to that. And some are related to viruses. You guys know HPV, herpes simplex, HIV, and this Epstein-Barr. Talked about that earlier. So yeah, these cancers, these viruses will cause these cancers. Salivary gland tumors are pretty rare, but we'll just show you, just know that they can happen. Here's one in your parotid glands. Here's one in a sublingual gland. But usually these are benign and can be removed. But when you see an obvious bump in your here, it could be a tumor in your parotid gland. All right, and lastly, organ failures. If your head fails, yeah, you're dead. But talking about individual components of it, with loss of the ability to mastication is chewing, you're going to see older people often get frailer if they can't. And you know, 4 days of having dentures and having really good care, when you lose your teeth, eventually you can't eat, you can't get nutrition, and you die. You see that in elephants, really old elephants. Their teeth are worn down and they just die. So we have ability not to do that. But if you have, you know, issues with your teeth or your jaw, and you can't chew properly, you have problem with nutrition. Problems with swallowing. It can be caused by many things. You can have breakdown, a neurological problem, or especially if a serious head problem is affecting the nerves of swallowing. Your real risk is for aspiration here. I'm thinking of, we just talked about the lungs, is that the protectiveness of your epiglottis coming down. If you don't have that ability, you're going to have more aspiration, more pneumonia, and that's going to kill you, right? But polio affects, we don't see that too much today, but affects it's motor neurons, it affects swallowing. Yep. Accident, cerebrovascular stroke. Yeah. So problems with swallowing, life-threatening. Can be. Sleep apnea. Apnea means not breathing. So there's a neurological basis. Babies sometimes have SIDS. They die suddenly because they stop breathing. But here we're talking about obstructive, and this happens with adults. And if you're, the anatomy here, look back here, when you're sleeping, if you have a big uvula or soft palate, or it can happen with obesity. If you snore quite a bit, it could be because as the air is being forced down past these passageways, they're not open all the time. Yes. So the sleep apnea, they can give you a sleep study and see what you're doing, but it means you stop breathing, sometimes hundreds of times during the night. Like you stop breathing for like 30 seconds or a minute, then you start breathing again. So it's not a very restful sleep. Often some of the symptoms of sleep apnea are that you feel tired all day and you feel depressed because you're not sleeping at night. And so they can give you this positive pressure device, this kind of thing you wear that keeps it open so that you can get a restful night's sleep. Make some noise though too. Yeah, and then go in, they can do some surgery too. But in any case, sleep apnea is something that can't be controlled. Asphyxiation, yes, you can be strangled, right? You can have a piece of food get caught here in your epiglottis, and so you may need a tracheostomy. And all you should know what that is. You might be able to give it right now if an emergency situation. I think I would if I was in that situation, although never did it. You just find the trachea here, and if you cut in the middle, the blood vessels are to the side. By the way, I'm not giving you medical advice, but I can feel the rings of my trachea, and so there'll be some bleeding if you cut in the middle, but it's not going to. Not being able to breathe is going to kill you before there's a little bit of bleeding. And then you can stick a hollow tube in here and you've bypassed the larynx. So if there's something up here that's preventing you from breathing, you can put a tube right in here and allows the air to move in and out. So that's a tracheostomy. And yeah, loss of voice. You'll see if you have nodules on your vocal cords or cancer, they have to remove that. Almost always smoking related. And last slide, salivary glands. Again, if they are destroyed, you don't make spit. So you're like, oh, I can't really chew very well, but your teeth are going to go bad. There's going to be other issues. But you can have autoimmune diseases like that Sjogren syndrome, where it breaks down your salivary glands. And hearing loss, if you completely lose that, and deaf, of course, you lose your sense of hearing, but again, it's not life-threatening, is it? All right. There we go. So we've covered a lot of things looking at here, from the common cold, we had to cover that, to tooth issues, to middle ear issues, to sinuses, salivary glands, cancers, of course. So there we go. A lot of important stuff going on from here up, right? We'll get to the brain and eyes as well. So hope you enjoyed.